Well, it's my pleasure to be with all of you today, and I know that our time is precious, and so I'm just going to get right to our business at hand and introduce my good friend Len Schleifer and ask him to come up and join me to my left. While he's doing that, I'm going to introduce Len. Len is a common spirit, a physician scientist. We overlapped in our training at Weill Cornell Medical College. Len did his medical training in medicine and neurology, and has an MD as well as a Ph.D. in his training, and then went on to found Regeneron, which many of you know is one of the leading biopharmaceutical companies in the country today. Certainly known for its innovation, and now for bringing 5 approved drugs to the marketplace. I think what makes a number of things that make Regeneron unique, one of which is they historically have had a very strong in-house R&D program. But it's safe to say that Len is the recipient of many, many accolades. Science magazine ranks it as the #1 place to work in the biopharma field. And Forbes has designated Regeneron as the 3rd most innovative company in this country. So a number of many kudos to Len. So what we're going to do this afternoon is I'm going to engage in a conversation with Len for about 20-25 minutes, and then we're going to open it up to Q&A. So be thinking about things that you'd like to discuss with Len. But let's start going back to our Weill Cornell days, Len. And you and I both had the opportunity to train with one of the icons of American medicine in neurology, Dr. Fred Plum, and his colleague, Dr. Jerry Posner. I wonder if you could help us understand how you went from being a physician scientist to co-founding with George Yancopoulos Regeneron. What was that story about?
Okay. Well, thanks, Betsy. Thanks to the Boston College CEO Club. I have a few comments to make about whether we should really have a CEO Club, because I'm very much against the trend of deification of CEOs. It's a bad idea, and misrepresents, I think, in some cases, what we do. But I am very grateful for the invitation. In fact, I'm quite shocked. As I left to come here, I spoke with my wife, and she said, "What are you doing?" Well, I've got this invitation to this really famous CEO club where they have all these real CEOs, you know, from all sorts of industries, all these really important people. And I asked her in her wildest dreams, did she think that I would be the keynote speaker? And we've been married for 43 plus years. And she looked at me and she said, "Sweetheart, you're not in my wildest dreams." So anyway, with
Love that honesty in marriage, right?
I've been lucky, actually. I'm married, and some people say to a daytime spouse and an evening spouse. Harriet, my evening spouse, I just told you what I get there. My daytime spouse is George Yancopoulos. He and I have been partners at Regeneron since we opened the labs if you can believe it, in 1989. And for those of you who are wondering, I don't think there's much to wonder about. Betsy was quite junior to me at Cornell.
By a year.
At any rate, so when I was a young scientist, I had trained, I had the real privilege of training with a scientist by the name of Al Gilman. And Al was a fabulous mentor of mine, and he was a Nobel laureate, Nobel Prize winning scientist, which didn't come to a number of years after I was in his lab. I was one of his first graduate students. And after I left that lab, I wanted to become a clinician. I trained, I did turn down the MGH, and there's a story there, but we don't have time for it. But I wanted to train with Plum and Posner at New York Hospital, because I thought that was the sort of the gravitational center of the universe for neurology. I got well trained at that, and then I lost my edge in research because, as you know, it's hard to do both. And first I did all that research, and then I went and trained as a clinician. And then when I tried to get back in the labs on the faculty, I started seeing all these papers being published in the mid and late 80s by a company called Genentech, who I'd never heard of. And I was shocked that they were cloning all these interesting things and doing amazing research. And you know, I have some fair amount of business experience. As a young man, I had my own snow shoveling business, which was actually pretty good when it used to snow a lot in New York. And a few other things like that, delivered drugs for a drugstore. But I kind of had an entrepreneurial spirit. And I said, geez, maybe I could do like they do. They seem to have lots of resources. And I went to Fred Plum and I said, Fred, I need 1 day a week, which my faculty position allowed, that I was going to try and start this company. I was very lucky. A fellow by the name of George Singh from Merrill Lynch believed in us and gave us $1 million, which to me seemed like more money than I could ever imagine existed. We started the company, and Fred was very gracious about it. And then a week later, I told him, if I'm going to do this, I have to resign, because how can I recruit people and ask them to give up their positions if I wasn't really committed myself? So I resigned, cut the cord, and started to build the company. That's sort of how that all got started.
Yeah. Tell us a little bit about George, because at that point in time, you know, George had trained in Fred Alt's lab at Columbia. He was starting to use molecular biology techniques for cloning. He was very active in the vascular biology field with VEGF. How did the two of you get together?
Yeah, we were at we had assembled, Al Gilman helped me assemble this great scientific advisory board, and we were meeting in a hotel in New York City, and we had Arthur Kornberg, a Nobel Prize-winning scientist, advising us, 2 other Nobel laureates, Mike Brown and Joe Goldstein, Fred Alt, and a whole bunch of people, and everybody sort of politely was trying to tell me that my research skills might be a little rusty because I was trained as a biochemist and the world was becoming molecular biology, and they said we need to get somebody who can really do all that stuff, and which was fine by me. And somebody suggested, let's call George Yancopoulos, who's the smartest young guy they could come up with the name. And we were very lucky because George was the child of Greek immigrants. You know, he's one of these guys who graduated #1 from Bronx High School Science, #1 from Columbia and medical school, and #1 in the undergraduates, and #1 in everything he ever did. But he had a hard-driving immigrant father who said, well, if you're so smart and you're the best in everything, how come you're only making $31,000 a year? So I convinced him I could pay him more than that. And in fact, the story, this is 100% true. I thought George had agreed to come, and he called me up and he said, well, I have one more meeting I'd like to have with you. Can we have dinner? And I said, fine, let's do it. And he gave me the name of a restaurant, and I went I'm looking for him. I don't see it. Then I see 2 people at a table, and I thought that might be George. I have a mild case of prosopagnosia, for those of you who don't know what that is. And I don't recognize faces particularly well. My wife says it's because I don't pay attention, but I do pay attention, but I just don't recognize faces. It's been that way all my life. I recognize voices. I don't hear voices, I recognize them.
Spoken as a neurologist.
Well, exactly. Anyway, I didn't quite recognize George, but there he said, Len, come on over. And sure enough, who's sitting there? It's George and his dad, because his dad needed to interview me to make sure that his son would be okay for his son to partner with me. And so that's how we got started. George is a phenom. And it's part of the reason I object to a CEO culture. I don't want to pour cold water on the CEO club, but I think there's way too much attributed to the success of an organization to the CEO. Certainly I know in my case, it's equally shared between George and I, or may even frankly be, since George is the genius who discovers all the products, it's probably more his success than mine. But certainly it's never just one man or woman who happens to have that title. And that's sort of how I've tried to behave, and it's maybe why we've been able to maintain people working with us for decades.
Yeah. I think one of the interesting aspects of Regeneron and why you've been so innovative over the years is you really believe in having R&D in-house. And that's really a model that a lot of American biopharma is starting to get away with. Tell us a bit about that, and as you do, explain for the group the really unique technologies that you have around monoclonal antibodies and fusion proteins.
Okay, so that's a lot to cover, but let me start by saying that when I went into business, I thought that the business we were going to be in was discovering drugs that could make people's lives better. And it wasn't a very complicated business plan. The notion that you would do this any other way than by research, to me, that was just sort of what made the most sense. Now, the first thing I did, I remember, which I'm actually very proud of, is that the investors who gave us some money, you know, people who give out money to entrepreneurs like to have a lot of rules. One of my directors, Tony Coles, is here. He does that. If you're looking for some money, a little plug for Tony. But they always put in these rules. Well, you know, we're going to need an audit committee to check up on you. Okay, I don't know what that does, but that's fine. And by the way, you can't really pay yourself. We'll have to have a compensation committee to decide how much you're going to make. I wasn't too thrilled with that, but I went along with it. But I turned to them and I said, well, wait a minute, if we're going to do this, how about if we have a technology committee? And you know, there was not a single company that we could find in America at that time that had a technology committee. And here we were going to be in the technology business. Now virtually every company in the world has a technology committee. But the remarkable thing is too many companies, I think, are not willing, they give lip service to what they think they are. They want to be research companies, but they're not. If you look at the boards, that's a pretty good indicator. Our board, the majority of the board of directors are physicians or scientists, 2 Nobel laureates. We had 3. My friend Al passed away last year, unfortunately. But half of the board are members of the National Academy of Sciences, which is almost unprecedented, as is George, by the way, on the board, a member of the National Academy. So we don't just say we want to do research. I mean, the ethos of the company is research. Now, I'm going to make a claim here that I am the most unique CEO in the world for the following reason. It sounds braggadocio, but it's not. I'm the only CEO of a public company that will sit up here that if you were to ask me how much we earned per share last quarter, I cannot tell you. I simply cannot tell you. I could tell you on the day we announced all this because I sound very erudite when I read the script, but for those of you who are shareholders, that's a good thing, okay? But the truth of the matter is that that isn't what's important to us. So what's important to us was always science and technology. Of course we want earnings, but we're not interested in this quarter's earnings or next quarter's earnings. We're looking for the long haul where if we do well by patients and we succeed at our business plan, of course we're going to have great earnings. The technology to cover that question, the technology advances that came from George and the men and women on his team were really quite, came as a product of necessity. We wanted to do something. I'll give you an example. We wanted to make antibodies that were fully human. And there were a few companies that were doing that. And so people said, well, let's partner with them. And we talked to them. But the easy way out for me was, George, I know you can do it better than they can. Let's just invest. And of course, George would always say, no, I can't, no, I can't. Of course, he always did, you know. So he built a mouse that was the biggest, the largest, the most complicated genetic engineering ever done, where he replaced all of the codes that are required for an organism to make antibodies, like when you get immunized, when you get your measles shot, you know, you make antibodies to the virus. Well, you have to have a genetic machinery that does all that. But a mouse has mouse machinery and a rabbit has rabbit machinery. Well, he took the human machinery and put it into a mouse and called it Velocimmune, and it's now the standard in the world, the best way that one could make a human antibody that are now the source of our drugs. Another technology, just to give you an example, the human genome sequencing, which had promised, was hyped. I was in the White House last week. It was even hyped a little bit by Francis Collins, but how much it really delivered when it was done. But now it actually has the possibility of delivering a lot. And once again, we had this debate, should we do it or find somebody else who's done it? And we decided to do it. So what have we done? We've now sequenced at Regeneron the largest collection of people in the world, and married that sequence collection with their de-identified electronic medical records. So we now have 150,000 people's genetic sequence coupled with their electronic medical records. We did this all with, blue chip informed consent, with de-identified work with Geisinger Health System. And it's now, frankly, the paradigm that everybody wants to follow. And you can ask amazing questions. You literally go to the computer and say, give me everybody who's over the age of 90 who is not demented, and then start to say, well, is there something genetic about that? We know obesity causes diabetes. What about all the obese people that don't have diabetes? Do they have something genetic? What about allergies? We're very interested, and we have I'm not allowed to mention Dupixent, which is a drug that
you can't, because I'm going to ask you about it, so you might as well talk about it now.
I got some note that I couldn't plug anything, so, but it was recently.
But I can ask you.
Okay, go ahead.
Would you tell us about Dupixent? Tell us about this great new drug you have for atopic dermatitis.
Okay, so one of the things that George and the gang believed in very strongly is that that what causes allergy was part of the immune system that could be manipulated with a drug. And if you could dial that to basically take an allergic person and turn him into a non-allergic person, because we really don't need that part of the immune system. There's no great evidence that you need to be an allergic type person, that we might be able to have a treatment for a lot of different allergic diseases. Well, one of which we just got approved, since somebody is here from Sanofi, I should say with Sanofi, our terrific partner who helped us develop this and helped fund the development as well as actually conducting some of the development. We just got approved for this terrible disease called atopic dermatitis, which is, if you know anybody with this disease, is a terrible, terrible, terrible disease, because it's like having constant poison ivy for your entire life, scratching, itching, miserable, not sleeping, suicidal. And the stories that we've had in terms of how this has changed people's lives is frankly why we went into this. So we're very proud of that. And frankly, Dupixent is not just, we hope, going to be a drug for atopic dermatitis, because it is sort of dialing back the allergic part of the immune system, and we're looking for it to be, we have a treatment, a final stage treatment for asthma, which we hope to submit, which is a terrible problem, for nasal polyps, for eosinophilic esophagitis. Remarkably enough, in this environment, it's actually been, there's an organization called ICER, which is based around this area, which is very critical of the pricing of the pharmaceutical industry. They actually came out and analyzed it and said, for once we were willing, here's a company that brings a drug and prices it at a cost-effective price. So we were very proud of that as well.
Let's segue into drug pricing.
Okay.
Tell us about drug pricing.
Yeah, drug pricing has the potential to be the undoing of our industry. We're not getting it right, and we're tone deaf if we think that people just don't understand. There is the argument to be made that the public doesn't understand some aspects of this, which is, how can it be that an industry that we have a drug called Eylea, which takes people who are legally blind with macular degeneration, the wet form, and gives them driving vision? Well, you've heard of drugs for AIDS, vaccines for childhood diseases that otherwise were scourges. You've heard about cholesterol-lowering drugs. We have one of those. I mean, the industry produces unbelievable, frankly, miraculous things. The fact that you could come up with something that you could inject in someone's body or take by mouth and make their asthma go away, or make their cholesterol go down to levels that have never been accomplished before, or give sight back. You would think that, after in this town, after celebrating that guy Brady, who was,
he is pretty good.
Yeah. After the,
We got to clarify things. Are you a Giants or a Jets fan?
I'm a Jets fan.
Okay,
Mrs.
okay, all right, now it's all clear.
I know, Jets, Mets, and Knicks, worst 3 franchises in America. Anyway, the Celtics didn't do so good last night, so.
Yeah, rub it in.
I'm just saying, I wasn't rooting. I was rooting for them, but we were back on
drug pricing.
Drug pricing, yes.
Yeah. No, but seriously,
but the industry. So why is it that the industry?
What's the responsible response? What's the responsible response by the pharmaceutical industry?
So we do have to communicate how hard this is. We do have to let people know that if we're not successful, our entire society is going to be overridden with, unfortunately, elderly, demented people from Alzheimer's disease, which is going to be $1 zillion a year to take care of if the industry doesn't come up with a success. And that's just one example. Diabetes, heart disease, these are things we really, not to mention the next thing that comes along, whether it's Ebola. We stepped up and came up, we actually have something that worked with, we got something very quickly, although the Ebola went away. But
it'll come back.
I think it is going to come back. There were unfortunately a few deaths in Africa last week from. But the point is that you can do all these great things. Why are you hated? Why is the industry ranked right there below media? And how can it be that insurance companies? I know John Hancock is here. I like them, but how can it be insurance companies are now loved? We all used to hate the insurance companies, right? Who loved the insurance companies? Nobody. Now, somehow and now everybody hates the pharmaceutical industry. And you have to ask yourself why. And part of the reason is people don't understand that our system is the best system in the world. System comes from the Constitution, where our founding fathers, right there between Congress's ability to declare war and levy taxes, is their ability to grant patents, which the founding fathers knew we were going to be entrepreneurial. Lincoln, our only president that ever actually got a patent, he didn't make any money on it because he didn't commercialize it, but Lincoln said that patents are the fuel of interest for the fire of genius. More drugs are invented in the United States than any place else in the world because our system actually works. We have the NIH, we have these great academic medical centers, we train scientists, we train clinicians, we know how to do clinical trials, we have a great regulatory schema, we have entrepreneurs, we have capital markets, and we have the world's greatest ecosystem, but it's in danger. And so that's why I've been pretty outspoken about criticizing, I'm not going to mention by name unless you really push me, the people who I've felt, and I'm not talking about the people who do the horrible things, the Shkreli's of the world, they'll buy up a patent, don't invent anything, and raise the price from $1 to $1,000. I'm talking about the more insidious problem, which is when people every year are raising their prices by 15%, sometimes 10%, twice a year. That's where we start to, we get in trouble. And we have to stop doing that. And we have to start pricing our drugs. And we're proud of the fact that with Sanofi, we priced Dupixent in a way that the most critical people in the public arena looking at this said it was cost effective. That is, it delivered the value. And so we have to deliver value. People tend to think of health, drugs, they're just entitled to it, but they don't actually understand where it all comes from. Yeah. And so we have a lot of work to do, but we have to start by doing better within the industry, and then we have to, because the worst thing is if the government came in and started take away all the incentives. If you take away all the incentives, we'll be like Russia. Remember, Russia's got plenty of smart people. They can put Sputnik up there, before we did, and they have a space station, they can make all these weapons. But do you know how many drugs come out of Russia? 0. I never go to sleep at night saying, I hope not, I'm not going to read in the morning a drug competitor from Russia. It just never, it doesn't get to me. They never do it because they don't have the incentive, they don't have the system. Yeah. But if we take away these incentives, capital is agnostic. Yeah. It will go elsewhere and we won't have these drugs.
Well, and we may be poised to face that issue. Len, you were at a White House briefing not long ago. This is the first year in which China will spend more on biomedical research than the United States. You understand very well the pipeline from the NIH to academic medical centers to biopharma entrepreneurs in the marketplace. what can we do as leaders to ensure that the United States stays at the forefront of biomedical research?
I think we're going to have to, I don't know I don't know if this can be led in the same way as it can a groundswell. Somehow the public has to demand that we continue to do what we're the best at doing. That we really are the best in biomedical, our biomedical research complex is the best in the world, truly the best in the world. I'm sure people come from all over the world to be at your hospital. You know, they use our drugs, they want to see how we give stuff, and people criticize our medical care, it's not that efficient. Efficiency isn't the only variable that you can measure, but somehow we have to convince the people, because that's only the thing that affects politicians, I think, is that the people demand that we have a robust system that includes the National Institutes of Health that is extremely well funded, that is investing in basic research. You cannot always invest in directed research. Sitting down and coming up with a cure for something doesn't work unless there are people who are just following science at a basic level, and then the aha moment comes that maybe what happened in that worms study I was doing leads to me to understand why people are getting demented. You can't predict that stuff, and that's why we need this NIH system. And I was willing to go down and tell the president that, and I just think that it would be a tragic mistake to underfund that.
Yeah. Thank you, Len, for your advocacy. Let's open it up to the audience. Questions, comments? Yes. Are we going to use a microphone?
It's coming right behind you.
Yeah, behind you.
Thank you so much for your... Oh, they're not working. Is it working? Okay.
Yes.
Thank you so much for your conversation. I wanted to bring up a point about drug pricing, because I've always been sort of interested in that. And I remember a statistic a few years ago, I made a comment on, that for the major drug companies, they spend more money in advertising per year than they spend in research per year. And I thought that was an interesting number, and just as a consumer, I get somewhat tired of ethical drugs being advertised on television. I won't comment about which ones, although I'm still trying to understand what it means to have two people holding hands in two matching bathtubs, but
Well, okay, there's a lot in that question. Let me see if I can parse it a little bit, which is that, first of all, we spend probably one of the highest ratios of any company in our industry on research, and we don't spend enough by other standards elsewhere. As to whether or not it's appropriate to do direct-to-consumer advertising for drugs, I think that sometimes it really is. And let me give you the best example. When my chairman, Roy Vadris, was at Merck, they came up with the first statin, okay, which was Mevacor at the time, and then Zocor. And the cardiologists at Merck were not convinced, after talking to their cardiology friends, maybe some of the people in this room, I don't know, which they, no, who needs a drug to lower cholesterol? We can just do diet and exercise. That works fine from our patients. Well, we know that that's not true. And we know that advertising and convincing patients to go to the doctor and demand a treatment to lower their cholesterol is probably one of the single greatest public health things that the industry has done under the rubric of advertising. So in some cases, it's actually a good thing to communicate advances to the public, because the docs don't always get it right. These are my customers, so I think they're fabulous, but that was recorded, right? We'll cut that snip right out. They are fabulous, but sometimes they do need a little education. I think that the problem of drug pricing in part stems from, my mom, should rest in peace, I remember she had something, she had to go to the hospital, and she didn't even care because she wasn't looking at that bill, and maybe she paid $50, and then she would go to the drugstore. How can they get $3 a day for a pill? You know, so when you're paying, when the consumer was paying for drugs, but not paying for you to put the stethoscope on them, they began to hate what they had to pay for. And that was the beginning of the end. And now what's happened is that the insurance companies have pushed more and more to patients in so-called co-pay, co-insurance, and what have you. So it's pretty easy to rile up the base, whether it's Elizabeth doing it, or Bernie doing it, or Donald doing it. They were riling up the same base of people who didn't want to write those checks for their drugs. We have to figure out a way. A better insurance system, of course, would work. More responsible behavior in the industry, but explaining and delivering more advances is the ultimate way to say the industry delivers value. There's another question.
I guess you've opened Pandora's box about drug pricing, but there are a couple of comments that I'd like to make, and I'm interested in your response to it. I think a couple of the reasons that people are upset about drug prices are they see what people are paying in the rest of the world, and many of the countries they're not paying anywhere near the amount that they're paying here. And the second thing is the amount of money that the pharmaceutical industry has spent to legislate, for instance, in Obamacare, that Medicare is not allowed to put pricing out for bid. And so there are a couple of things that I think have helped pharmaceutical companies to have people be a little wary of them.
Yeah. So those are two good points. The first of which is there's a problem with the wrong solution. The problem is that the United States and its consumer and its entrepreneurs and its capital markets and its NIH and everything we just talked about, yes, we are subsidizing the rest of the world because the products that we sell here, the consumer is paying more for than they're paying for in France or in the UK or in Germany, countries that can well afford to pay a fair price. It is something I have talked with people in Washington about. There's not an obvious solution on how to regulate this. I've actually got a few ideas, but I think it would be great because it could equilibrate a little bit the system where prices could come down. But the solution isn't just simply to bring prices down in the United States, because then there won't be enough money in the system to incentivize the capital investment. And the solution is not to let drugs come in through Canada. I can just tell you that I would never take a drug, and no secretary of HEW or HHS is called, or the FDA has ever said that they could guarantee the safety. The bringing drugs across the border is fraught with so many issues. So I don't think that's a solution, but you have correctly identified the problem. As to negotiating with Medicare, there's two changes to Medicare that people talk about. One, I think we should do right away. This negotiation, whether Medicare could be a negotiation, we negotiate with Medicare all the time. And it's a fallacy that Medicare doesn't negotiate. It just doesn't do it as a single payer. So when you have your drug coverage through whatever plan you might get as a senior, you have to buy your Part D coverage, and if it's whether through it's CVS or Humana or whatever it is, each of those plans negotiate with us and extract discounts and rebates. So it's a popular myth that there's no negotiation. Yes, of course, if there was a single payer negotiating, it wouldn't be much of a negotiation. It's like, when my child was younger and he wanted to borrow the car and we negotiated, he has no chance, right? There's no negotiation there. So, you're not going out after a certain amount of time because you don't have a license to do it, and that's it. So, but if we had a single payer, it would be no negotiation. It would be just like every other country. This would be your price. And our system of incentives, remember, it's right there in the Constitution. Ben Franklin got it. Jefferson got it. They put it in there because they wanted to have a way to incentivize entrepreneurs. This country was going to be built as an entrepreneurial, capitalism based system. So the one place where it's bad at Medicare, what I would change immediately, is that if you're under 65 and you get my drug and you can't afford the copay, I just write you a coupon that says, here's the copay. It's against the law to do that with somebody in Medicare. The reason is that the system was originally designed so that patients would have skin in the game. So the skin in the game concept, in my mind, comes from the fact people living in Florida or Arizona, retired, they didn't want it to be Tuesday afternoon bridge, Wednesday afternoon golf, and Thursday afternoon at the doctor. They didn't want it to be an activity. So they said, if you're going to go to the doctor, you're going to have to pay a little bit. But it is not skin in the game if you're asking somebody who's got cancer to pay $20,000 a year, okay? That's just not right. And the industry would be only too happy to help those people out, but we can't do that because it's actually against the law. I've made that known to my fellow resident of Chappaqua, but she didn't get to do much with it. And I passed it along to the Republicans as well, but nobody has yet seemed to want to tackle that. I do think it's a reasonable approach.
In your quest for solutions to as many of the diseases you talked about today, you can tell your wife that you are the
Don't say it.
in many people's wildest dreams who are depending on you to find a solution to it. So
Thank you very much. I appreciate that. George likes to say nobody prays for iPhones, for iPhone 8, but then when they have somebody who's sick, they do pay for a drug. I like to say if you're in the ICU, you don't worry too much about drug pricing. You want to know if you can get cured. Yeah. Or if your mom's got dementia, you want to know that there's a drug there. We have to behave more responsibly. We have to price fairly. We have to, but we can't eliminate the incentive-based approach to our industry because that is the only thing that distinguishes us from the rest of the world. Our system actually works. So, but thank you for that.
Len, this past week, we've lost a colleague here in Boston, a real icon of the biopharma industry, Henri Termeer. And I'm wondering if you could just take a minute and reflect on Henri and his life and his contributions.
Yeah, for those of you who don't know Henri, I've known Henri for a very long time. We were on the bio industry organization board of directors. I'm the longest serving CEO in the industry, and Henri was actually about the same, minted around the same time as I was, so we knew each other for many, many, many years. Henri was a true visionary. For those of you who don't know him, what he did at Genzyme, which is now a Sanofi company, but based right here in Boston, is quite remarkable. He understood the point I'm trying to make here, which is that we are an incentive-based society, and people respond to incentives. And there were these diseases that were very, very rare, ultra rare, they came up with a clever name called an orphan disease, okay? They were just forgotten. There was no incentive. The NIH doesn't do applied research. They would never come up with these cures, and we needed a drug company to want to do this. But nobody would do this because the truth of the matter is you spend $1 billion coming up with a drug that can treat 1 million people, 100,000 people, 1,000 people, or even 100 people. It costs, because so much of the cost is in the failures, the costs aren't exactly all that different. Henri realized that these cures could be had if he could create a system of incentives, which means society had to be willing to pass certain laws about orphan drugs, that how they were going to be regulated, how quickly they could get approved, make it easier for them to be developed, and that people would pay a very high price for them. Who ever heard of paying $250,000 a year for a drug? Well, if you speak to the mother of a child with Gaucher's disease, which I have done, which Henri took this woman with him around the country and around Washington to convince people that, yes, we have to pay that because I need people to have the incentive to do this. It's in our blood. It's in our nature. We do things that are, of course we all want to do the right thing, which is why I'm proud that you mentioned that we were viewed as the best company to work for in entire healthcare, not just
healthcare. That's right.
A broad category. We're very proud of that. We actually we try and do the right thing. My quick quick aside coming back to Henri in 1 second, my quick aside is that one of the solutions that I thought to this problem of this gap that everybody talked about in the last election between the wealthy and the middle class or the lower middle class, and the gap is widening, I don't think that's the gap that's really we have to worry about. We actually have to worry about the gap between capital and labor. Our society, being a capitalist society, works okay when the amount of wealth, if you consider that the big pot every year, the amount of wealth that's generated by labor is somewhat reasonably proportioned to the amount of wealth generated by capital, okay? And if too much of in our society, money is generated by, wealth is generated by capital, we have a big problem. And that's where so it's not just that there are rich people and poor people, it's just that the money being generated that's creating a lot of the wealth is being done by capital as opposed to labor. And so I think one solution for that is to do what we do at Regeneron, and Henri did it at Genzyme, and a lot of companies in our industry do it, is to spread the capital down to the people who work in the company. We have people who become millionaires who worked on the loading dock because they've been with us for 20 years, hung on to their stock options that every single employee gets, and that's our ethos, and that's sort of doing the right thing. Anyway, coming back to Henri, Henri was a visionary. It's a great loss to the industry. He created an entire industry that didn't exist. I'm not talking biotechnology, I'm talking about orphan drugs. He single-handedly created this industry. We're sorely going to miss him.
Yeah, remarkable man. Len asked me earlier why I invited him to come to Boston to speak. So Len, this is a not so subtle attempt to convince you in Regeneron to move to Boston. You would do well here, really well here. My colleagues would agree.
That's fair. I have to root for the Celtics and now
And the Red
and
Sox.
Brady. Yes.
Yeah.
And everybody.
Okay.
Yeah.
On behalf of Boston College and the Carroll School, please welcome and thank Dr. Nabel, Dr. Schleifer, for a wonderful afternoon.